Hi, Karen here. I wanted to give you an update. It's been 27 weeks since my Lapiplasty surgery, and I'm doing very well. I do still have some swelling as I expected, but I'm back to work. I'm able to wear steel toe boots all day long. I do put my foot up at lunchtime and a little bit before I leave sometimes, and it really just depends on what I've been doing. The scar is not noticeable, and that's interesting because I wasn't sure how that was going to come out. And that may be individual to the person, but you know, I seem to be healing fairly well. I have numbness still, or it has a sensation of sleeping. It used to be numb, and then I started getting some kind of pressure feeling back. But I still don't really have surface feeling back in many areas, and I'll videotape my foot and show you just what kind of movement I have and where the numbness is and where it swells too, because it swells more in just a certain location around the big toe and maybe the underside of the ball of the foot. I was back to work. I was back to work after 11 weeks post-surgery, and I spent about 2 weeks back to work, and then we went into the shutdown for coronavirus. And I have to say that the additional 2 months that I had at home were very helpful. After 11 weeks, I was doing okay at work, but I really felt like I wasn't all that ready to be in steel toe boots running through, you know, running around and doing work in a hot environment. So I would say that if you have the option of not getting in steel toe boots or doing, you know, work out on the road or heavy work for 6 months, that you're probably going to be better off. I've done a lot of home improvement, and I like working on my house and doing things. And I've done a lot of that since, you know, and during the shutdown where I was able to rest when I needed to. And I did have the ability to do that. So you're not laid up with your foot up or anything, but you know, you do want to have the ability to rest. I'm not sorry still. I'm very, very pleased with the results, and I'm really looking forward to having, you know, less swelling and more mobility. And I am working at it too. I'm working at moving the foot. I can't go to therapy. You know, I was going to therapy prior to the coronavirus shutdown, and then, you know, after that I really couldn't go anymore. So I've been trying to do a lot of this stuff myself, and you know, I've been getting somewhere on it, but I'm not forced to do it. So you have to be disciplined and make sure you do the stretching and keep moving the toe up and down and back and forth. And I think giving your, you know, doing exercises to give your calf strength probably helps, you know, with the swelling, because your calf does play a role in pumping excess fluid out of your foot. But that's just my opinion of, you know, that it helps. But I like to go for walks and do things to strengthen my calf. This is what my foot looks like, my left foot, after 27 weeks. I'm a little bit challenged to bend it all the way, but it's really gained a lot of mobility. And I've been working at it. I can spread it out a bit, but not nearly as much as the other one. And that could be partially due to the numbness that I have, or the around here, the feeling is, it ends about right here, and around this area, I have less feeling. Probably this whole area, where if I touch it, it feels like not that sensitive. I can tell I'm touching it, probably less in the toe area, but I do have the feeling of pressure, so I can tell I'm touching it. And the foot looks pretty good, I have to say, compared to the other foot. It's a lot more a lot more similar than it was in the past, that's for sure. But the swelling, as you can probably see, happens more in this area, and the surgeon did say that's typical, that he had gone to a conference where they were comparing notes, and they were somewhat marveled at the fact that the patients don't get swelling that lingers in this area, which is the surgical area, but they do typically get the swelling in this area that lingers. It's not really painful. I mean, underneath it can sometimes feel, you know, more swollen, and it feels like I'm stepping on something, so I don't want to go barefoot, or, you know, I want a little bit of padding there. But overall, I hardly think about the fact that I had surgery on the foot. And I do these. This is, I don't know how much you can see, that I do have a lot more mobility, but not as much as the other foot. I don't think I'd want to wear spike heels right now, but I could probably wear somewhat of a heel if I were interested in doing so. So I did lose the toenail on the second toe, but it's coming back. I'm not really sure if that was from me falling or if that had something to do with the surgery, because they did make that additional incision over here. Let's see, right here, where they had put the clamp in and pushed against this tarsal. So I really don't know if that caused the black toe that I had. But yeah, I'm doing pretty good, and I'm pretty happy with it. It's a lot better than it was.